so much. It's really an honor to have you here at the conference again this year.
I love coming back.
Well, is this your second or third or?
Yeah, second or third.
Second or third.
Second or third.
Can't remember. They run together, but I got to ask you, why do you keep coming back?
Well, because this is where the Lord's doing his work, and it's so important for the Christian community to stay connected. Church is pretty fractured, but I think when you look at parachurch, there's a lot of potential for unity, and there's certainly a lot of overlap with what we do.
Yeah, I think people do unite around mission.
Yes.
And, the mission has to be around Jesus. But, anyway, it's always, I'm kind of blown away that you keep coming. That always surprises me when you submit a workshop, even before I get to ask. And I think I did ask maybe the first time, but I'm really blessed that you're back. It's great. And thank you for cutting some time to allow some of our folks to get to know you a little bit better. So when I first kind of contacted you guys or ran across you guys, you were in Baltimore, and now you're not far from, we're in Cincinnati today, but you're not far from here in northern Kentucky. So where do you belong? Like where did you come from? Give us a little bit of your background.
Yeah, it's a little too poetic to say wherever the Lord plants me, but it does seem to be a bit of a Forrest Gump trajectory. So it's kind of hard to say. I grew up overseas primarily, but I'm a Midwesterner at heart.
Yeah.
I kind of came from that middle class Midwestern Wisconsin sort of.
Yeah.
You might hear the nasal tone.
Yeah.
And but then my formative years were overseas, mostly Thailand and Iran.
Wow.
And then my schooling was back in the United States, for graduate or undergraduate, graduate, etc.
Yeah.
And then I established my family here, and so I haven't been overseas since. Yeah.
Missionary family or?
No, my father worked for the international school system. Mm-hmm.
Oh, wow.
Yeah, it was a great way to grow up.
And then you went into education originally, right?
I did. Yeah, I thought it would be a good idea to be a high school English teacher, and then I tried it.
Yeah.
Yeah, it's hard in there. It's a battlefield.
It is. It is. So my wife's a teacher, so I can say it vicariously, like I'm close to somebody who suffers, and who has suffered. But
yeah.
So you have become, I think, really, as far as I'm aware, among the Christian community, probably the go-to person to kind of understand the whole domestic sex trafficking issues in our country, which are not small. And how did that become a passion for you?
Yeah, not by choice. Not by choice. I was actually doing consulting down in Washington, D.C. I'd like to say minding my own business. God had other plans. And really through just a curious set of circumstances, I was invited to go with this church group on a outreach in downtown Baltimore, and in the worst part of downtown Baltimore. And I was curious, and so I went. And I have to say that the experience of seeing that compassion in action, seeing the people who are reaching out to the suffering, and in particular to a population that we overlook.
Yeah.
And that was devastating to me, and it planted what I call like a holy discontent that just said, God, why is this happening? Somebody should do something. And we always know those are the famous last words, right?
Right. Yeah. God, please send somebody.
Please send someone qualified to do it. Exactly.
Yeah. It is it's not an overlooked population. Mm-hmm. It is a population we want to deny exists. Like it's an intentional thing to turn a blind eye to that. And I so appreciate just your advocacy to the church, to engage the church in this, because it is it's oppression, it's slavery, it's the worst of the worst. I just appreciate what you've done. So you became aware of the issue, you saw what was happening. Is that how the Samaritan Women shelter came about?
It really was. Once I had encountered the first victim of sex trafficking that I had met and understood a bit about her story, her trajectory, that created such a outrage for me that I wanted to know why there weren't services for people like Heather, and went on a bit of a quest to look for how somebody like her in her situation could get help, and kept coming up empty. And so that's when it really became clear that that was God's calling to say, well, I did this, I broke your heart for what breaks mine, as the song goes. And so that led me to leave my corporate life and move into full-time ministry, and do a lot of other crazy things like sell my home, sell my company, whatever.
Yeah. So would it be inappropriate for me to ask you to tell us a little of Heather's story? Like, what was the story that, Yeah, no,
she is a treasure in my life. She's emblematic of the issue. But I will say that people across the nation who do what I do, particularly in shelter care, all seem to have their Heather story one way or another. And in her particular situation, what begat that anger in me was she was a really almost a prototype, because she was a young girl in a single parent household, in a modest area but not poverty, and her mom had a boyfriend paid a lot of attention to her, not inappropriate in the home, as she recounts, but after mom and boyfriend broke up, he kept in touch with this 14-year-old girl and convinced her to run away with him. And he proceeded to traffic her up and down the I-95 corridor for about 4 years. By then, she's addicted to drugs, and she's in ill health. She's pretty tore up. And he dumps her off in Baltimore City and moves on. And so that's how she, was sort of transplanted. And by that time, really felt like going home was not an option. This is what she knew. Yeah. Drugs were controlling her. And all of those factors were so helpful for me to understand from the very beginning, particularly that for most of our survivors, there is childhood abuse, usually childhood sexual abuse, that sets them up for further victimization. Yeah. And so she's been very helpful, and she's also been a lifelong friend.
Yeah, I appreciate you sharing her story. I appreciate her giving you permission to do that.
Yes.
And because I think we overlook a lot of that, and we just make bad assumptions about how people get to that in that place in their life. And so you're not just a do-gooder, like you're a Ph.D. and help us understand, just give us a snapshot of the scope of this problem in the United States.
Yeah, unfortunately, I can't spout numbers that we can absolutely qualify, because we have a disparity in how numbers are collected, not only at the federal level, but each individual state, each individual county, if you will. Those databases are not always connected. But not only that, that assumes that we are actually finding everyone, and that would be a fallacy as well. This really is a problem that's kind of hidden in plain sight. My doctoral dissertation was on familial trafficking, and that's parents selling their own children. And so those are children that we aren't going to see on the proverbial street corner, such that could be counted. Right. And so that adds to the complexity and our inability to say, well, let's just land on a number. But there have been some studies. For example, in the state of Texas, University of Austin did a study just on their state, and they calculated that there were 72,000 children just in that state that were being exploited. And so that's one state and one study. So we don't know. In Kentucky, they had done an analysis over a 5-year period of time, and they looked at the children who had been screened positively for sexual exploitation. And they had 696 cases within that particular sample. They studied those in some detail and found that upwards of 47% of those cases, almost half, were familial.
Oh, my.
And so we're beginning to learn more. It's one of the things we'll be talking about here at the conference is familial trafficking, because I think for a medical professional, and frankly all of us, we want to believe family is the safest place to be. We want to believe that a mother or a father or an uncle couldn't possibly. And it's much more comfortable to think of stranger danger.
Right.
But we're finding actually that the incident of familial trafficking in the United States is somewhere between a quarter to a half of all child trafficking cases. And so that's something that we have to become much more attuned to identifying.
Yeah. So I want to go back to your experience with Heather and then what led to the Samaritan Women shelter, which tell us, for people who don't know about it, just tell us a little bit about what that is. And
Yes, I started the Samaritan Women, which was a residential program for female survivors of trafficking. We took minors and adults, primarily adults, and we ran that program in the Baltimore area for about 13 years. Got up to the point where we had 3 homes and a vocational training program and an education center, and it was just expanding nicely. But concurrently, we were also getting a lot of inquiries across the United States. How are you having success? What's your model? Would you teach us? And that's when another important person crossed my path, and that seems to be the way the Lord talks to me, right? And he said to me, your background's in education. Why aren't you leveraging those gifts to help to build up the next generation? And the more we studied the landscape and saw the deficit of care across the United States, the more I realized, that really is the next move for us. So, difficult move. We suspended direct service after 13 years and moved on to becoming the Institute for Shelter Care.
Right.
And that's what we do now, is we're raising up that next generation of providers.
And so basically you guys help start and maybe support shelters across the United States. How many shelters are there in the Christian community that you're aware of?
Oh, I'm very aware. There's 211 shelters across the United States that are open and active as of today.
Yeah.
It's a very dynamic landscape. Of those, 63% of those shelters are Christian shelters. So it is the larger portion of the market that identifies as a Christian organization, and that's been pretty consistent over my tenure.
Yeah.
While the number of shelters has increased significantly in the last 15 years, because when I started there were like 7 of us. It seemed like there was no. We were able to, in 2016, we were able to identify 22.
Yeah.
It's grown a lot as a field.
That's a really short period of time, honestly.
It really is, and I think that's something we have to have more patience for, is that it's an emerging field. There aren't standards of care. It's where we're very different from the medical community, because there's established protocols, there's established standards, there's credentialing, and our field has not entered into those structures yet. It's still pretty crude, but there's a great deal of earnest to this work, and that's why I'm excited about the things we could do together.
Yeah. Last year when you were here, you did workshops on the familial sex trafficking. And I went to one of them, but you did 2 of them, and they were standing room only.
It was packed.
They were packed. People are interested in this, and people in the CCHF world are interested in this. And I got to be honest with you, I was just shocked and disgusted and felt like I needed to go take a shower at the end of it. I mean, no reflection on you, but just I don't want to think about that issue. Right. It's just so freaking hard to think about extremely vulnerable people being trafficked by their own family members, and then to see the prevalence of it and to see how it happens, and to know that there's a really good chance that in all the CCHF communities we're seeing patients that are probably being trafficked. And like, what are the things that you want our docs and our social workers to sort of be looking for, recognize, and then what do you want them to do about it?
Yeah, it's difficult because it's so contextualized, but I would say one of the greatest things we can do, which is probably the hardest, is to slow down and trust our gut, trust the spirit within us, because so often when I'm presenting, I will have people come up to me and say, I knew something was off. I could feel it. In my gut. There was something strange about that dynamic. And truly, Steve, that's how I got into this particular subtype, because there was just something so off about the relationship that the survivors in our program had with their families that created this nagging curiosity that led me to sort of chase into the dark to go see what it was. So I would say slowing down, asking the next better question. We do definitely need to understand more about the relational dynamics to realize we're not necessarily looking for a checklist of symptomology, right? Unfortunately, it's not that straightforward. It is very subtle because we're talking about individuals who oftentimes have been raised in these systems.
Right.
It isn't what we talk about a lot in sex trafficking publicly is we talk about the grooming phase.
Yeah.
Right? And so you've got some 14, 15-year-old girl, boyfriend's paying attention, right? All of a sudden gifts and that, and we say, oh, that's grooming. But that's a period of time to transfer trust and to transfer agency onto another person. But we have to understand in a familial context, that may have been since birth. That we can't have a line of demarcation and say, oh, here's when grooming started. What I've found in the survivors that we've worked with who've been trafficked within their own homes is they'll say, it's just what we do.
Wow.
It's normalized. And so that makes it all the more difficult for your practitioners, for any of us on that side, because when that person perceives that is their normal, they're not going to present to you as if something's wrong.
Right.
And that's where we have to slow down, listen, take the gut. And I would say also, we believe very much in care teams or multidisciplinary teams, because sometimes just connecting with another peer to say, did that seem off to you? Did you notice how that mother didn't seem to care about that child's injuries? Isn't it odd? Those types of things. I don't think in a medical setting you're going to be able to conclude that it is a situation of trafficking. That's going to require a police investigation.
Sure.
But you can definitely conclude that that child is in an abuse situation.
And so if you have that gut feeling, like, what's the action? What is the act that, like, how do we intervene? Like, medical providers think about diagnosis intervention, like,
Right.
All right, I've diagnosed this is a possibility, it's something that needs to be explored. Like, what's the intervention that makes sense? Because it could, you've got an entire person's life that is structured, that's built into this very, very warped structure. Mm-hmm. Like, what's next? They call you? What's
law enforcement, for
Yeah,
sure, because
sure.
it goes back to the prior
Right.
question about numbers. Right? Because if we circumvent that system, we don't collect the data, or at least we don't collect it in as coordinated a way. Yeah. And so a law enforcement intervention, absolutely. Now, I recognize that that's going to be a tough call, and maybe what will happen in certain situations is you may see that child 1, 2, 3 times, just like you would if you were determining that there was physical abuse that was going on in the home. Like, why is that child coming back with repeated bruises? Why is that child having this?
Sure.
And so, unfortunately, it may take a while for us to say there's more going on than I realize. Now, we're going to talk about the risk factors. We're going to talk about the co-occurring factors of vulnerability in the session. And those may lead to better questions that we could have, practitioners might be asking to the child and then to whoever has brought that child for care.
I'm pretty sure that we have at least an audio version of your talk last year, and we will again this year for at some point in the next few weeks after the conference. But I want to ask you, this is a big issue, and it is like a very heart-tugging issue and a difficult issue. You keep coming back to CCHF, and you know us well enough now. Like, tell me what you think. What could a partnership between the Institute for Shelter, if the ISC and the CCHF, how could we work together? What would you love to see happen?
Careful, this is sounding too much like Santa.
Yeah, well, I don't know.
There are a number of things that I could say are long-term and immediate. The immediate would be for us to connect all of your locations with the shelters across the United States. That would be an immediate. That would perhaps allow the shelters to have a go-to clinic, a go-to medical provider that they could build a relationship with. We see all kinds of medical conditions, and we have to do almost a CSI episode trying to tease out, is this physiological? Is this psychological? Is this trauma? Is this thyroid? Like what? And we don't know. We don't have that expertise. So that partnership where we could say, if you're in Des Moines and you're in Des Moines, can we at least connect the two of you together? One relationship that we had that was incredibly valuable was we had a pharmacist, and she was just kind of on speed dial with us. Mm-hmm. She never saw any of our clients directly, but at intake, we would send her a list of all the pharmacology and dosage that individual had on their person. Just put, age and weight, and completely absent any identifying information, just look at this list of chemistry and tell us if there's anything we should be concerned about. And I think because of her, we've saved some lives.
Wow.
Because sometimes these victims will have commandeered pharmacology.
Sure.
They may have other people's pharmacology, and we don't know what that is doing to the survivor. So that's a critical relationship that could be in place. The number one medical need that we saw in our 13-year tenure was dental.
Really?
Absolutely, by a wide margin. And so we desperately need dental students, people who can do cosmetic dentistry. Survivors get hit in the face a lot. A lot of the sexual abuse is in the mouth. They've had bad nutrition. There's a tremendous amount that we need in the dental arena. So connecting, making partnerships, seeing if we can do that at the local level. But we also have projects, as I mentioned earlier, of how we need to grow in some of our protocols. There is not a standard protocol for the tests or assessments that should be done on a victim prior to going into placement. Mm-hmm. And if we could work together on defining those protocols, that would be, and then propagating them across the United States, then all the shelters would know, okay, when she's coming in the door, there's been a pregnancy test, there's been an STD test, there's been a thyroid test, she's been screened for TBI. Those are things that we really need to know,
right?
Because it could change the way we respond to the survivor.
I think that's a very realistic ask. Mm-hmm. And, of course, you guys have more shelters than we have clinics. I don't know if you know that or not, but there's maybe 320 Christian clinics that I know of around the country, but of those, most of those are very, very small, maybe only open a day or two a week, something like that, or sometimes even less than that. Oftentimes they don't even have a full-time employee. Mm-hmm. Then we have, probably 150, 160, maybe half of the total number would be clinics that have full-time employees, full-time staff, are doing some sort of continuity care, and that's really what you need. Yeah. So I would love for any and all of those to be able to kind of figure out how to reach out to your folks and how your folks can reach out to our folks. Like, what's your website, or how would they go about?
Sure. Well, instituteforsheltercare.org is our website, but you're welcome to put up my email address if that would be, helpful. Sure. I'd be happy to field those. You can also,
you have no life outside of
this is my life. But I would say also for your network, we have a pretty robust interactive map on our website. So if they go to tools and they see the shelter landscape map, they could search on their state, zoom into their geographic area, and see who's already in that. They can sort by faith affiliation, population served. So they could initiate those contacts on their own. I'd be hard-pressed to imagine that a shelter's going to turn them down with offers of help. But let me say this, that it could also be, there may just be individuals who are willing to help with certain projects. I would love to have a network of physicians, dentists, mental health professionals who would help us with creating courses for the direct care staff.
Yeah.
Because we need to explain in layman's term what some of these psychological diagnoses are. We need to explain how medicated assisted treatment affects an individual, because they're on the front lines dealing
that's right.
with the manifestations of those, of that chemistry or of that trauma. And oftentimes we just don't come with the background of knowing what to do. We do a tremendous amount of training at the Institute. I think we're up to about 90 courses that we offer.
Wow.
And sometimes they're as finite as, non-suicidal self-injury and how to respond to an incident of cutting. We see that probably about 50% of our population. So, and then that's something where somebody who's particularly talented as a medical professional and teaching might say, yeah, I could do a module on handling anything that has blood on it. That would be so helpful.
Yeah.
It really is, for some of our stuff, is pretty basic, so that we can kind of all get on the same page for protocols.
Well, I want to make an appeal through this to our listeners. Please check out this website. Tell us the website again.
Yeah, www.instituteforsheltercare.org.
Yeah, that's pretty easy to remember. And we're CCHF.org. We also have an interactive map where you can go and look and see where we have CCHF clinics around the country, Christian clinics around the country. They're all primary care, pretty much. But a lot of them have, women's health departments, and almost all of them will have partnerships where they can refer their patients to where they can get women's health and such. So that's a big part of it. I hope you keep your voice active in our community, Jeanne. I really do. I also want to let you know, after I sat through your session last year, it's just personal, but I just got a burden for you. Like, I think this is such like, you have to have a special measure of grace to be as deeply engaged in this as you have been. And I've just, I've been praying for God to just refresh and sustain you. How do you deal with this? Seriously, like I've had a couple of situations where when I visit a CCHF clinic, I'll shadow a doctor or whatever and kind of get a feel for what they're dealing with. And there was one in particular that was overwhelming to me, and it was a wonderful pediatrician that I was shadowing, and I expected it to be all wonderful children that was just happy and healthy. And it was kids that were that weren't. And she had a little girl patient who clearly, at a very young age, was being sexually abused by her family. And it was just overwhelming to me. It still it's stained me in both good and bad ways, I think. But how do you deal with things like this? Like, what do you do for yourself personally?
Well, interestingly enough, more studying has been my self-care. And I know that seems counterintuitive for some people, but the way I explain it is I have, for the last almost 20 years, been in this field that is chaos. Yeah. It's dark, you're floundering around, there's no rudder, and it's demonic and dark and chaotic. But academics are like the counterbalance to that, because it's a 15-page paper with 1.5-inch margins, right, in Times New Roman, and I'm not being silly about it. There's something about the order of my needing to bring order to chaos, and that is mobilizing. When you talk about graces, I'll just say that, yes, I think that the Lord has afforded me particular graces. One, He's wired me as a warrior. And so this is really just bringing out my true nature, which is fighting for the vulnerable. And that is a big part of just my wiring.
I think that's why we connect so much with you. I think our community is these compassionate warriors who are fighting for the vulnerable, and I think we connect in that spirit.
Yeah.
Yeah.
And you know where that really came to light to me is in the very early days when I was talking about the work we were doing at the Samaritan Women, and people would come up to you and they'd be like, I wish I had your passion. I wish I had your sense of purpose. And I think, yeah, I wish you had that too, but we all have that potential.
Yeah.
You know, one of the graces that God has afforded me is for the last 20 years, I haven't known a day when there wasn't purpose.
Yeah.
Right? It's a bolt out of bed. There's work to be done.
Yeah.
And that is its own reward.
Yeah. Yeah. Well, I'm all about exploring a deeper partnership between the CCHF community and you guys and what you're doing. And I just want to thank you again for being there, for being willing to step into a really dark place with the hope of the gospel. Mm-hmm. And, you know, one of the you're going to do a workshop. You're doing different workshops this time, and one of them is on the question: Is it ethical? I think something like this. I don't remember the name of the workshop. What do you?
Sort of is the religion causing harm type of thing.
Yeah, like if we're trying to help somebody, is that appropriate for us to be addressing them with the gospel and that kind of thing, or is that an inappropriate kind of relationship?
Yes.
And I think you see the gospel as the power of God for salvation in a really clear way. It has been in your life, and
yeah, I look forward to that. It was the study that we did was just published end of last year, was predicated on that accusation that often gets thrown over the fence of you're forcing religion, you're shoving Jesus. You've heard the phrases, right?
Yeah.
And the warrior in me went, oh yeah? Let's prove it. But truly, to turn around and say, then let's study to find out whether or not that is true.
Yeah.
And so we did a study of survivors, and we asked them about their experiences with various faith practices. And so that's what I'll be presenting is the result of that study. It's enormously encouraging.
Yeah.
If anything, I'll say the spoiler alert, the answer is double down.
Yeah, it is. It is. And there's all kinds of good science to show that that's valuable, and it's what patients want.
Indeed.
They think it's totally appropriate. They want it, and they trust caregivers and providers more than they trust, to be honest with you, more than they trust pastors.
Yeah.
In many cases. And so, anyway, I think that's great. As you were sharing about just academics being your
self-care,
you know, it reminded me of a passage that I read either yesterday or day before yesterday in my quiet time in Proverbs. It's either Proverbs 2 or 3, where it says that discernment will save you, and understanding will guard you. And I think that you know, that academic, that commitment to understanding the issues, to understanding this and to break it down, that's really where understanding comes from. I don't, obviously from the fear of the Lord, but in that context, you know. So I think that's great. And I think a lot of our folks, like you, find that academics are their love language, you know.
I just did a 4-hour session with Christian counselors, and they asked me to kind of do a hover over the last 20 years of the anti-trafficking movement. Where have we come from? What have been the major strokes? And where's it going?
Yeah.
And just having to engage in that intellectual exercise of hovering over the issue is also a way of gaining understanding, right? Because sometimes you have to come out of the trench and you have to look at the landscape and you have to see, and then you can say, okay, this is a different... There's almost a calm that comes with saying, I'm seeing this from a new way, and then to be able to share that with others so that they can likewise join you in a fresh perspective.
Yeah. Well, I don't want to take up any more of your time. I know you've got a workshop that you're getting ready to do just in a little bit.
Looking forward to it.
Again, thank you so much for your time. Thank you for being here. It always is an honor to have you among us. So thanks so much.
Pleasure.
Okay.
Thanks, Steve.
All right.